Hi, I'm Dr. Carolyn Ross, and today I'm going to be talking about intergenerational trauma and shame. Now, nobody's born feeling ashamed. It's something that we're taught or that we learn. But did you know that shame can be multi-generational? When you were a child, were you ever made to feel that something about you just wasn't right? Because I know I was. Maybe you were criticized or bullied for your size, the way you dressed, or something else. And if so, this can lead to shame. Now, I've experienced being shamed both personally and professionally for mistakes that were completely unintentional. Whenever that happened, I felt like I'd been punched in the gut. And all I have to do is think about those moments, and the feeling comes back all over again. That shame can just wash over me once again. Now, toxic shame, however, occurs when our feelings, our wants, and our needs are not met, and actually when we're punished for even having those feelings. When you're exposed to toxic shame, it can flare up throughout your life, lasting long past the situation that started it. For most of us, this toxic shame can follow us into our adult lives and also into our parenting journeys. We're wired to shame because it's the way that our parents reared us and their parents before them. Sometimes, to avoid our own shame, we also shame our children. If they, for example, embarrass us in public, making them feel the same not enoughness that we have felt. It's multi-generational. Now, maybe you don't know that shame can also be a direct result of childhood trauma or be passed from generation to generation in intergenerational trauma. And the shame is about something that happened to you. For example, if you were abused or neglected, or you grew up in poverty or had other childhood adversities. If you were shamed as a child, you may have come to believe that you're just bad or worthless. And then you develop an inner critic who tells you you're bad whenever anything goes wrong in your life. And that younger child part of yourself believes it. But what shame ultimately does is rob you of a sense of security and self-confidence that can plague you throughout your life. And that's the bad part. Now, psychologist Dr. Richard Schwartz describes shame in this way. He says, shame is a two-part phenomena. There's a critic who says you're a bad person, and then there's this young part of you that believes it. Usually there's then another part of you whose job it is to get away from the bad feelings of shame. And sometimes that part of you will resort to extreme behaviors like overeating or binging or using drugs or alcohol. And that then can bring on more shame. It's like a vicious cycle. You feel shame, so you reach for something to reduce the shame, and then you feel shame about what you did. Lately, I've been reading Mark Nepo's book, The Book of Awakening, which gives you a meditation to follow every day. And there's one that I really hooked me. And in that meditation, he suggests, first of all, sit quietly with your feet flat on the floor in a place where you won't be interrupted. Take a couple of deep cleansing breaths in through your nose, out through your mouth. Now with the next breath, as you breathe in, just state to yourself the fact, who I am is enough. Let's do that one more time. Breathing in, who I am is enough. You may not believe it right now, and you may not be convinced of it, but it's one of those fake it till you make it things. So let's do that again, breathing in. Who I am is enough. And with your out breath, breathe out embarrassment and shame, self-doubt. And then breathe in again. Who I am is enough. Exhale, toxic shame. Exhale, negative self-talk. Inhale, who I am is enough. Allow every part of tension, both physically and psychologically, to go in the out breath so that you're relaxing all parts of your body. As you breathe in, who I am is enough. Practice that over the next week and see what shifts for you in your life. I'll see you next time.